Hello, myself Dr. Syed Nazim. I'm a consultant dermatologist. I practice at Max Hospital and at my clinic by name Royal Lush, which is located in Saket, New Delhi. So the topic is hair reduction, and I must tell you that hair reduction is beyond lasers. So we do have many patients who do come to us and ask us that, doctor, I am not satisfied with the lasers. I have been to blah blah clinics. When I find the reason that those clinics are really not managed by professional dermatologists, and that's the problem. So before you step in for a hair reduction, you need to understand whether the place is run by a proper qualified dermatologist. The reason is that there is only 20% reasons of this increase in the hair growth, which is called hirsutism, and only there 20% is idiopathic, and rest have, most of the times they have some hormonal imbalance. So first let's understand what is this hair growth. It's called hirsutism. Hirsutism is, it should be differentiated from another term called hypertrichosis, but we talk about the hirsutism and where the role of the lasers are. So hirsutism is an increase in the terminal coarse hair in female in a male pattern distribution, like around the face, around the sternum, the chest, around the nipples, and even in the lower trunk and all. This is called hirsutism, and now we need to find out the root cause of this before actually the lasers are effective. As I said, 20% are idiopathic, where there is no reason. However, there are small changes, hormonal changes, but 80% there are some reasons behind it, and the most important reason is increase in the androgen level in our body. So these androgens are secreted by the ovaries, so we have to rule out the PCOS, and a lady who has a PCOS needs to be evaluated properly, asking the history of weight gain, infertility, and a lot of other things. So a lab investigation is important, a hormonal profile is important, and ultrasonography to check out whether activity of the ovaries, the bulkiness of the ovaries, and that's how, if you treat that properly, and that's how the laser works. The other causes is like some drugs can give us this hirsutism, like anabolic steroids, OCPs, and methyl dope. A lot of other drugs can. So proper history again has very important role. And the third important thing is like onset of this problem, and a lady comes and says, okay, from last 3 months I am having this problem, then we need to be very serious. There are some tumors which are like the tumors from the adrenal tumors, or for that matter ovarian tumors, which can give increase in the androgen levels and can eventually land up in the hirsutism. Could be just one symptom of it. And so these are different things that we need to understand before you go for just the hair reduction lasers. So in a nutshell, I must tell that anybody having the hirsutism problem should be evaluated properly before that lady opts for a laser hair reduction. Thank you very much. If you have any queries related to this problem, you can get back to us, and below mentioned are our contact details, and we'll be happy to help you and sort out your issues and problems. Thank you.